does your back feel after you deadlift a bag of dog food from your back seat up to your shoulder? Strong? Or does it depend on your experience level? Let's say you do that action every week for years. Maybe the first lift felt fine. Maybe at the 40th lift, you felt a twinge. Maybe after 10 years, you're not able to do that motion at all because over time, you've developed back issues. For many industries, back injuries are the most commonly reported injury category. Back injuries are not just acute occurrences due to improper ergonomics or straining. Most have developed over time from a series of smaller injuries or strains that eventually reach a tipping point. Musculoskeletal or MSK injuries affect muscles, bones, tendons, or nerves. This causes pain, which is a warning sign that something's wrong. Back pain is one of the most common types of MSK injury. Hazards that contribute to back-related MSK injuries include reaching, bending, or twisting while lifting, bad body mechanics, how one lifts, pushes, pulls, or carries objects, poor design of task method or workstation setup, repetitive lifting of awkward items, equipment, or, in healthcare facilities, of patients, and poor footing, such as slippery floors or constrained posture. The key to back safety is being proactive by understanding the hazards within your industry and the ergonomic changes that can reduce your exposure to those hazards. This course will, number one, identify hazards or risks common to industries most closely associated with back strain. Number two, provide ergonomic best practice to reduce hazards. And number three, explore early signs or symptoms of back-related injuries and early reporting. As back injuries can result from accumulated traumas to the back, it's important to understand prevention and early reporting. Back injuries can lead to worker compensation claims and disability if severe. Warehousing job tasks include lifting and lowering heavy items, bending, reaching overhead, pushing or pulling heavy loads, and working while bent over workstations. These types of tasks are known to cause musculoskeletal injuries such as muscle strains, herniated disc, and lower back pain. Now, there are certain tasks you perform in this industry that increase exposure to certain ergonomic hazards. When receiving loads, you're frequently pushing or pulling products, stepping onto or off of a dock, looking up at product pallets and bending to reach or read a product. You likely are lifting or moving single boxes of product or digging into cases to retrieve individual products. Not only are there ergonomic hazards related to improper lifting or lifting beyond capacity with a warehouse job, there's also frequent sitting without lumbar support. Whether acute or prolonged, these hazards increase the risk of sustaining an MSK-related injury. When working to unload a pallet, ensure certain dock safety precautions are in place. You'll want to ensure the work floor is free and clear of tripping hazards. When working on the docks, ensure that dock levelers are in place, and when using a forklift, follow safe practices. For pickers, it's important to only tote items that are 35 pounds or less. For heavier items, try to move them to elbow height to reduce impact on the lower back. Practice good standing posture, reduce time spent while bent over or overreaching, and use anti-fatigue mats at workstations. Working in cold environments can cause you to use extra force, which increases the hazard for an MSK injury. There are a wide variety of roles in the healthcare field, from doctors to nurses to techs and nursing assistants. Each role has its own challenges, but there are ergonomic hazards regarding back safety that span job tasks. Being able to sit in an ergonomic chair with lumbar support is critical. If you've spent any time in a doctor's office, you may have noticed that small stools are common. Nurses and doctors alike go from room to room to sit in chairs not designed to be sat in for long spans of time. Likely, the room is too small or a chair with lumbar support seems overkill. However, the amount of time healthcare professionals spend seated with improper ergonomic positions adds up throughout the day and compounds over a career. Lifting patients or providing assistance with heavy lifts is the leading cause for back-related MSK injuries in healthcare. As with other industries, improper ergonomics, lifting past weight capacity, attempting a lift while reaching, and other improper lift hazards contribute to both acute and prolonged back injuries. Practicing good office ergonomics is important as well. Ensure you're using a chair with lumbar support and working from desks that are the right height. Many computer stations are mobile and designed to be used while standing. Good standing posture should be used while working. When providing lift assist to patients or working to stabilize a patient, it's important to follow weight guidelines and ergonomic lifting techniques. Never lift a patient from behind, and determine if they can assist, as that will help inform how many others should assist with the lift. Industrial and factory environments have similar MSK-related hazards to warehousing and package handling industries. There are significant risks from standing at stations for long hours, having repetitive tasks, and needing to transport products. The reporting of cumulative trauma disorders, known as CTDs, has steadily increased. The most prevalent injury reports for CTDs come from the meatpacking industry. Ergonomics isn't just a fancy word, it's a strategy to keep you working safely at your job. Industrial ergonomics explains how to design the workplace or job to fit your needs. Roles that require heavy or repetitive lifting, standing or stooping, and repetitive motions have a high risk for developing MSK symptoms. These actions put unnatural strain on your body. While identifying actions or job tasks that increase risk for MSK injuries, it's best to be transparent with your supervisor. It's also important to listen to your body while working. Remember, that twinge in your back is a sign that strain or stress is being put on your body. There are some ergonomic best practices that can help avoid strain or stress on your back. Now, the main problem is bending over to pick up something off the floor. The action feels normal, simply tilt yourself forward. But this action and then lifting something heavy from the ground is exactly the type of motion that can cause a back injury. To correct this action, try setting up your station with the heavy items on the surface, so grabbing the box or item will be less exertion on your back. Another common pitfall is twisting to set down or grab a heavy object. This motion is unnatural for your back. Now, to correct this issue, keep heavy objects at arm level and use your feet to turn your entire body. Using your legs more will help, as they are set to better handle weight than the muscles in your back. Another common ergonomic issue is continuing to bend over a workstation or having to overreach. The better practice is to make the workstation better fit you. Keep the workstation at waist level and reduce the distance you need to reach. Many workstations are already set up by the time you begin work. If you find you're having to continually bend or overreach, this is the type of information to share with your manager or safety team to help diagnose ergonomic hazards. When working, use all the tools you have available. If you have a cart or pallet, don't pull the load. It forces your back and arms to do more work than they should. Instead, always push heavy loads. Similarly, using a dolly, cart, or other tools will help protect your back while also making work more efficient. Office ergonomics are equally important. Sitting exerts more pressure on your back than standing. The way you sit impacts the amount of excess pressure. An ergonomic best practice is to sit relaxed in a chair with lumbar support. Normally, you'll be sitting upright and using your keyboard. That nearly doubles the amount of pressure on your lower back, and it gets even worse when you ignore all the best practices. Do not underestimate the value of a good work chair. Back pain commonly affects the lower portion of the spine. As outlined, MSK-related back injuries can be caused by a muscle strain, a ligament sprain, or other injuries from improper lifting, poor posture over time, a ruptured disc, or arthritis. Now, some back injuries are acute and immediate. Those should be reported to your supervisor, and medical care should be provided promptly. However, many back-related injuries or pain is due to cumulative trauma disorder. This makes recognizing and reporting early signs important. The reporting of issues should be seen as an opportunity to improve workplace ergonomics. Early signs or symptoms include aching or stiffness, burning sensations, fatigue, muscle spasms, or pain that worsens with movement. These early signs can be intermittent or seem to get better before regressing back to feeling painful. Employers pay tens of billions of dollars in workers' compensation costs for back-related injuries. Other expenses, due to the nature of back-related MSK injuries, could double or triple over time. Workers with severe back injuries can face permanent disability, preventing them from returning to their jobs. This also limits their ability to complete basic living tasks like pushing a shopping cart, carrying a child, or the ability to maintain their homes. OSHA estimates between roughly 1/4 and 1/3 of workplaces in general industry are currently protected by an ergonomics program. Whatever industry you find yourself in, there will always be a need for ergonomic best practices to avoid acute or accumulated MSK-related back injuries. Learning how to adapt your work environment to best suit your needs, changing bad habits, and practicing safe motions will play a vital part in avoiding stress or strain to your lower back. Back injuries are the most commonly reported incident and, depending on the severity, can cut a career short. It's important for both employees and managers to champion better work ergonomics. Now, while OSHA doesn't have specific standards around ergonomics, OSHA will cite for ergonomic hazards under the General Duty Clause.